I'm Alex Leff, one of the leaders of the neurotherapeutics team at University College London. Our research focuses on using new insights from psychology and neuroscience to help us develop novel, effective treatments for patients with cognitive impairments caused by stroke. Today, Zoe Woodhead is going to tell you about our most recent study, which tested two therapies to improve word reading ability in participants with central alexia.
Central alexia is a type of acquired reading disorder where other aspects of language, such as speech production or comprehension, are also impaired. It's usually caused by stroke to the left hemisphere. This lesion overlay map shows the areas that were damaged in the 21 participants of the trial. The damage was predominantly in the left temporal, inferior frontal, and inferior parietal lobes. There are different types of central alexia, such as phonological dyslexia, deep dyslexia, and surface dyslexia, depending on which part of the language network is damaged. The severity of the disorder can also vary between participants, but even mild cases can have a serious detrimental impact on quality of life. In this study, we aim to find out whether reading ability can be improved with computer-based reading training or non-invasive brain stimulation. We tested two therapies in this trial. The first was iReadMore, a therapy app we created to target word reading problems after brain injury. The second was transcranial direct current stimulation, a non-invasive method of electrical brain stimulation that is believed to improve neuroplasticity during learning. The stimulation was applied to the left inferior frontal gyrus whilst the participants were using the iReadMore app. A crossover design was used so that all participants completed 2 4-week blocks of therapy. Both blocks included at least 34 hours of iReadMore training, about an hour per day. The brain stimulation was administered 3 times per week, for 20 minutes at a time. In one of the blocks, the participants received real stimulation. In the other block, they received sham stimulation, which felt the same, but where the electrical current was too low to have an effect on the brain. Participants completed reading tests at regular intervals throughout the trial to monitor any changes. The iReadMore app uses repetitive pairings of written words, spoken words, and pictures to rebuild associations between orthographic, phonological, and semantic neural representations.
Soon.
The training adapts to the participants' performance, which makes it suitable for participants with different types or severities of reading impairment. We predicted that using iReadMore would lead to a significant improvement in reading ability for words that were trained in the app. However, untrained words were not expected to improve. We also predicted that there would be more improvement when participants received real stimulation compared to sham stimulation. The results confirmed our predictions. After the first therapy block, reading ability for words trained with iReadMore improved, but untrained words did not. The same pattern was seen in the second block. On average, iReadMore training improved reading accuracy by 8.7%. The effect size of this change was 1.38. At follow-up testing 3 months later, the therapy effect was still significant. The brain stimulation boosted the effects of the iReadMore therapy. When participants were receiving real brain stimulation, their reading improved more than if they were receiving sham stimulation. The size of this additional improvement was 2.6% on average, an effect size of 0.41, and it was seen for both trained and untrained words.
Overall, our results show that training with iReadMore can significantly improve word reading ability in participants with central alexia, and that brain stimulation can enhance this therapy effect. This is good news for people with word reading difficulties caused by brain injury. We are planning to release a new version of the app online for people to use at home. However, the research highlighted some limitations of the therapy. Participants should be aware that only trained words are likely to improve. We didn't see any change in sentence or text reading after training, only word reading ability was affected. The training effects were modest, although 20 out of 21 participants reported that they had noticed an improvement in their reading ability. We were pleased to see that the effect of the therapy persisted until at least 3 months after the end of the trial, but we would recommend that participants continue to use the app if they want to keep up a good level of reading ability. If you would like to learn more about iReadMore or our other research projects, please visit ucl.ac.uk/aphasialab.